Today, I want to talk with you about pediatric clinical facts. Interest is the soil in which knowledge grows. If you have no interest, it is unlikely that you will learn. Once you have learned the subject, then repetition is the means by which you perfect and retain what you have learned. After learning the information, how do you know you understand it? The proof that you understand what you have learned is your ability to explain with clarity and teach others. In this presentation, I have given you small bites of information in pediatrics, which I have labeled clinical facts, which are useful for both exam preparation and clinical discussions. Let's begin. Bicuspid aortic valves and coarctation of the aorta are the most common congenital heart diseases associated with Turner's syndrome. Turner's syndrome is a problem with the X chromosome and only affects girls. These girls have short stature, webbing of the neck, low posterior hairline, protruding ears, lymphedema of the hands and feet, cubitus valgus, which affects the elbow, shield chest, and widely spaced nipples. Patients may present with amenorrhea, the absence of secondary sex characteristics, and infertility. Approximately 40% of patients have congenital heart disease. Webbing of the neck is a classic feature of Turner syndrome. Turner syndrome is a monosomy 45X that can present with congenital heart defects. Coarctation of the aorta is the most common. Renal anomalies, such as horseshoe kidney and duplication of the collecting system, may be present. Short stature and streaked gonads. In the newborn period, there may be a web neck and puffy hands and feet. Ductus arteriosus is an opening between the pulmonary artery and the aorta in utero. But hours after birth, this canal should close. If the canal remains open after birth and allows blood to flow from the aorta to the right pulmonary artery, then the condition is called patent ductus arteriosus. This condition can lead to left-to-right shunting, respiratory distress, and heart failure. The medical treatment involves the use of indomethacin, an NSAID that will reduce prostaglandin E2 levels and shut the fetal shunt. The most common congenital heart defect in congenital rubella is patent ductus arteriosus. The patent ductus arteriosus is present in approximately 6 to 8% of children with congenital heart disease, with a higher incidence in premature infants. Patent ductus arteriosus produces a machine-like murmur with a wide pulse pressure. Hypertrophic obstructive cardiomyopathy is the most common cause of sudden cardiac death in young people. It is inherited as an autosomal dominant disorder. Affected patients usually have a positive family history of hypertrophic cardiomyopathy and/or sudden cardiac death. Transient hypertrophic cardiomyopathy occurs more frequently in infants born to diabetic mothers and is characterized by the thickening of the interventricular septum. Most infants are asymptomatic and the condition usually resolves within 2 to 3 weeks. A continuous machine-like murmur over the second left intercostal space, which radiates to the left clavicle, is suggestive of patent ductus arteriosus. A high-pitched holosystolic murmur over the apical area, which radiates to the left axilla, is suggestive of mitral regurgitation. The presence of a loud holosystolic murmur over the third intercostal space at the left sternal border suggests a diagnosis of ventricular septal defect. A ventricular septal defect is the most common congenital heart disease in children and accounts for more than 25% of all congenital heart diseases. Membranous ventricular septal defect is the most common type of ventricular septal defect. Ventricular septal defect produces a holosystolic murmur that is best heard at the left sternal border. Definitive indications for surgical repair of ventricular septal defect include the presence of medically uncontrolled heart failure or growth failure, irrespective of age or the size and type of the defect. An atrial septal defect is an acyanotic congenital heart disease that accounts for 6 to 8% of all congenital heart diseases. An atrial septal defect murmur is a mid-systolic murmur with fixed S2 splitting. The ostium secundum defect is the most common type of atrial septal defects and is usually asymptomatic during childhood. Severe atrial septal defect may present with failure to thrive in young children, while older children may present with exercise intolerance and easy fatigability. Tetralogy of Fallot is a cyanotic congenital heart disease that accounts for 5 to 7% of all congenital heart diseases in children. It includes ventricular septal defect, overriding of the aorta, right ventricular hypertrophy, and pulmonary stenosis. Pulmonary stenosis and subsequent right ventricular outflow tract obstruction are the most important determinants of cyanosis in infants with tetralogy of Fallot. The X-ray of infants with tetralogy of Fallot shows a boot-shaped heart with decreased pulmonary vascular markings. The presence of a right ventricular heave on physical exam suggests right ventricular hypertrophy caused by pulmonary hypertension. This finding is consistent with Eisenmenger syndrome, a complication in patients with ventricular septal defect. Cardiac surgery is indicated for a newborn with a large ventricular septal defect. Medical management of a ventricular septal defect involves the use of diuretics and angiotensin converting enzyme inhibitors. Clubbing of fingernails is seen in cyanotic congenital heart diseases, but it takes a minimum of a few months for the club to appear. Coarctation of the aorta A narrowing of the aorta near the ligamentum arteriosum causes an acyanotic congenital heart disease and account for 5 to 7% of all congenital heart diseases in children. Coarctation of the aorta often produces a harsh systolic murmur along the left sternal border. The Centaur criteria are a set of clinical criteria used to guide the diagnostic testing and management of patients with a sore throat. The clinical criteria are the presence of fever, tonsillar exudate, tender lymphadenopathy, the absence of cough, and young or old age. Acute post-streptococcal glomerulonephritis may develop after a streptococcus group A beta hemolytic infection, such as pharyngitis or impetigo. Acute post-streptococcal glomerulonephritis diagnosis is usually made clinically based on symptoms such as edema, hypertension, oliguria, brown urine, which would include hematuria and proteinuria, and a recent history of infection. Treatment is largely supportive, which would include rest and a salt fluid restriction, with the administration of loop diuretics to treat hypertension. Acute post-streptococcal glomerulonephritis is usually self-limiting with a good prognosis. Well, thank you for listening. These pediatric facts, I hope by you repeating them, you will be able to remember them when you're given an exam, which is the intended purpose of this exercise. I wish you well. Good night.